Okay guys, we're going to talk about, this is really quick, really quick, cardiac labs. This lab right here, lipid profile, you're going to need to know. They also quiz you on this lipid profile in NCLEX, so you have to know. I'm not asking for borderline or high risk. I want the desirable results. Cholesterol, as we know, is not the greatest thing to have, and we want less than 200. Triglycerides, again, less than 150. HDL, the higher the better, right? Because that is your good cholesterol. And how do we raise our good cholesterol? Well, basically, exercise helps. 30 minutes, 3 times a week really does wonders. LDL is your bad cholesterol. We want to get rid of that as much as we can. We want it between 60 and 130. Okay? Remember, the good cholesterol is great because it removes all the excess cholesterol and carries it to the liver to be destroyed and get rid of. Okay? Your bad cholesterol is what basically causes the narrowing, along with other things like calcium and deposits and everything like that. But it causes atherosclerosis, and that's the leading cause of patients that have MIs. Okay, the homocysteine test result, I wanted to bring this up because of the fact that you're going to see it whenever we're talking about cardiac issues and MIs. Okay, what homocysteine is, it's a amino acid, and B12, B6, folic acid, what it does is it breaks down the homocysteine and changes it into other substances that the body needs. Now the problem with that is that if you have a high homocysteine level, it also says that there's something wrong, okay? That possibly you have heart disease or that you are vitamin deficient. The higher levels that you have is what we look at to say that you have a higher risk for heart disease. Metabolic syndrome, basically when you talk about syndrome, it's a bunch of different things that happen, and we commonly see them come together, but there's no rhyme or reason for it. One of the biggest syndromes that I hope you didn't hear the dinner's done. But anyway, one of the biggest syndromes that you hear of is Down syndrome. Down syndrome patients have different abnormalities going on, which generally don't how it could connect to each other, like the extra folds in the neck, the heart defects. Some are mentally challenged. All these different symptoms. Well, that's what metabolic syndrome is. It's looking at all these different aspects that don't really match up to each other, but we see it consistently with patients that have heart issues. Okay, large waist, a waistline that measures at least 35 inches for women and 40 inches for men. High triglyceride level, 150. Reduced HDL, remember that good cholesterol. Increased blood pressure and elevated fasting blood sugar. All of these point to a patient having metabolic syndrome. Okay, and all of these are really, if you think about it, are modifiable in one way or the other. So it's something that we actually can control. Okay.